going, so you guys just have your chat.
All right, sounds good. Welcome everyone. It's Erin, one of the midwives with Roots, and I'm here with Clare Antonioli. She's a pelvic floor physical therapist with Alpine PT here in Missoula. And we're here just to chat all things pelvic floor. Yay! So first, I guess, Clare, if you want to just introduce yourself a little more and share a little bit about what you do and how you got into this work.
Yeah, so I took a long kind of route to physical therapy. I danced, I was a wildlife biology person, all these other things, and I ended up working in a PT clinic, and I was like, oh, I want to do this. This is really amazing. And it was very shortly after I made the decision that I wanted to be a physical therapist that I found pelvic floor physical therapy, and I realized that that was the specific type of PT that I wanted to practice. So I was super lucky walking into PT school knowing that this was what I wanted to do with my life. So I was able to focus my education from like the very earliest parts into this specialization that I love so much. And most PT schools, you come out as a generalist. So you come out being able to treat everything, a shoulder, a knee, a ankle. Pelvic floor is not included in that. That's not part of the generalist kind of world. And so I've taken specialized courses in order to give me certain certifications and credentials to be a pelvic floor PT. And then beyond that, I've also done education in specifically how is the pelvic floor related to pregnancy and postpartum individuals.
Cool. And so just to start off with the basics, can you explain what the pelvic floor is and why we are even here talking about it today?
Yes. So I'm going to use my handy dandy model here. So this is a pelvis, and to kind of orient everybody, these would be your hip bones, those bony little prominences kind of coming out the front. This is your pubic bone in front. As we turn the pelvis around, we've got your lumbar spine or your low back, which comes into a bone called your sacrum. And then down here, you got this little tiny bone, that's your tailbone or your coccyx. So the pelvic floor muscles live in a little sling here underneath the pelvis, and the function of these muscles is to hold up all of your pelvic organs. So for women, that is the bladder, the vaginal canal, and the uterus, and then the rectum. And when these muscles work well and work functionally, then all three of those systems can just do their jobs and work really well. And so that is kind of where I focus my treatments when I am working with my patients. However, as you can imagine, this is a pelvis, and here's your hip, and I also look at hips and backs. And while pelvic floor PT does focus here, there's so much more that we look at as a full individual and human. So.
All right. And then how can pregnancy affect a pelvic floor? Like pregnancy, birth, postpartum, and then like vaginal birth or C-section. How does all of that play into how someone's pelvic floor might work?
Yeah, so as you can imagine, that pelvic floor, there's kind of holding everything up and supporting everything that is above it. And as just going through the whole pregnancy process, obviously there is the weight of the baby and the weight of the fluids and the weight of, everything that kind of happens through that whole process. And that weight is placed down on that pelvic floor, and that pelvic floor has to not only support everything that it was supposed to support before, but now all of these new things that are happening in your body. And so just the act of being pregnant can affect what's going on in that pelvic floor. So a lot of women will start to experience things like a little bit of incontinence, where they'll pee their pants just a little bit because their pelvic floor is just not quite there to support them, throughout that whole pregnancy time. And then we get to shift into the whole birth thing. And so when you go through a birth, whether that be a vaginal delivery or a cesarean delivery, you will put excess stress and strain onto that region. And so let's talk vaginal delivery first. Obviously, you are forcing this baby through that vaginal canal, through the whole kind of pelvic system, this fitting through here, and the pelvis itself is shifting and moving, and the coccyx bone is shifting and moving, and that puts a lot of strain onto these muscles. But these muscles are designed to do that. That is their whole function and purpose. And so, yes, a lot of things kind of happen to this region, but also it is resilient and it knows how to come back from all of that. Very often there's tearing, and that leads to scar tissue and other things of that nature. And I like to think of the pelvic floor like any other injury in the body. When you have a knee injury and you have to have knee surgery, like you take care of it and you rest it and you give it time, and sometimes you do your exercises and you do your stretching and you do all the other good things for it. And we always think of that for our knee, but we don't always think about that for our pelvic floor, like that we do need to like care for it and like do all the right things for it. When we kind of shift that idea more into cesarean delivery, the pelvic floor is still greatly affected by that, whether it be that there was a trial of labor and then they had to go through a cesarean delivery, or whether it was a planned cesarean. The pelvic floor is still having to support and kind of provide that stability for this whole region. And then the pelvic floor is also super important because these whole abdominal muscles have been cut through, that they have to be able to support your pelvis, because your abdominals are not going to be working as well as they need to until we can get those to kind of come back and recover from that surgical procedure. Is that all? Did I answer all your questions?
It does make sense. So thinking about that, like how would somebody postpartum after they have their baby, like how would they know they have a problem with their pelvic floor? Like what are symptoms of a problem?
Yeah, so first of all, I am one of those, of course, because I am a pelvic floor PT. I believe that all women should see a pelvic floor PT postpartum. It is the standard of care in a lot of other countries, that this is just a part of what you do through the pregnancy and postpartum process. So I don't necessarily think that there needs to be an issue for you to go in and just check. I mean, it might just be one visit where your pelvic floor PT looks at you and sees everything that's going on and goes, everything looks great, you're doing a wonderful job. And then you can feel great about yourself, right? But I feel like when we're actually looking for issues, obviously pain is a really big significant one. Especially pain with any of those functions that I was talking about. So pain with urination, pain with a bowel movement, or pain with like penetrative sex activities or other penetrative activities such as a speculum exam. Another one would be urinary incontinence. So if people start to notice that, oh, I cough and then I leak a little, or oh, I get this really bad urge and as I'm rushing to the bathroom, I leak a little bit. And those are all really good indicators that the pelvic floor is not working functionally and that we need to get in there and make sure that we get it to a place where it's a little bit better. And then also beyond just the urinary stuff, there's bowel. After you have a baby, oftentimes there's constipation or loose stool or anything else that can kind of be associated with that, and that is another thing that oftentimes the pelvic floor is influencing, and having a healthy pelvic floor can make all of that better.
Okay. Is it possible for people to have problems with their pelvic floor even if they've never been pregnant or had a baby before?
Yes, absolutely. So we often associate pelvic floor dysfunction with pregnancy and postpartum because there is so much strain that's put onto the pelvic floor in that. But actually, women that have never had babies can have pelvic floor dysfunction. Men can have pelvic floor dysfunction. Children can have pelvic floor dysfunction. And so for a long time, what I do used to be known as women's health. And we've been working on changing that and getting people to understand what we do as pelvic health. That we treat anybody that walks in the door with these problems of pain, incontinence, or other issues involving those kind of functional areas within the pelvis.
Okay. And what does a visit with a pelvic floor physical therapist look like? Like, what is that? What would that visit be like for somebody who's never seen one before?
So usually the very first thing that we do is just kind of hear your story, right? And come in and we talk about what are your symptoms and how do those symptoms affect your daily life? How many pregnancies and births have you had? What kind of births were they? Were they traumatic and there was a lot of tearing, or were they easy? Did you have a 10-pound baby, right? Mm-hmm. What did that look like? We'll also talk about the other functions. Are you having any leakage, even if that's not the reason you're coming in? Do you have any chronic constipation or chronic diarrhea? Do you have any pain with penetrative activities, right? And then I'll also want to address any other pain that they're experiencing. Low back pain, pelvis pain, hip pain, neck pain. It can be kind of the whole body I'm interested in. And then if the patient is comfortable with it, I am actually specially trained, and most pelvic floor PTs are, with internal examination. So for us to truly understand what's going on in these pelvic floor muscles, we have to be able to do an internal exam. And that allows us to feel, are these muscles tight? Are they weak? What's going on with scar tissue and other things that are happening there? And this kind of evaluation can happen either internal vaginally, if you have a vagina and you feel comfortable with that, or internal rectally. So when we're talking about men, that's obviously the choice that we take, is an internal rectal assessment. Or if you're working with people that have more of constipation, diarrhea, fecal incontinence, that's where we would go more towards that rectal approach. And obviously, it's really important that the patient is comfortable with that and consents to that. And so very often I will start that very first visit and they're like, I don't feel comfortable with that today. And I'm like, that's fine. And I will do more of a general assessment of like, what's happening in your pelvis and your back, and how is this whole kind of pelvic area influencing your pelvic floor, and how can we make this area healthier so your pelvic floor can be healthier. Obviously, I love to talk about this, so a big portion of also what I do is education. And talking, I walk people through that explanation of what is your pelvic floor, what's going on in your pelvis. And then a lot of like behavioral stuff that can go along with urinary incontinence, fecal incontinence, or constipation and pain with penetrative activities. And so I have handouts and all that kind of stuff to kind of start them on that path of understanding what's actually happening in their bodies.
Okay. And what would be like if somebody is newly pregnant and they're thinking about their pelvic floor, like what are things that you recommend that people do to help protect their pelvic floor and like decrease the risk of having complications later on? Like, is there anything people can do to help keep their pelvic floor healthier?
Yeah. So I think that for many, many, many years, we kind of believe that, oh, your pelvic floor just always needs to be stronger. It needs to be stronger, it needs to be stronger. And so everyone would say, just do your Kegels. Do your Kegels, which are contractions of those pelvic floor muscles, right? And what we're finding more and more is that it isn't always a strength issue. And that makes sense. I mean, every issue in our body isn't always just a strength issue. And we're finding that sometimes we have tightness in the pelvic floor, other things like that. And so I think especially with a newly pregnant women, the most important thing is learning how to relax their pelvic floor and how to use their pressure systems appropriately, because that relaxation is what's going to need to happen when they do kind of move towards that delivery stage. The way that I teach this is through defecation. Because that is a really easy way for you to be doing that similar type of pushing activity and relaxation of the pelvic floor. Obviously a lot less intense, but that is a really great place to kind of work on all of that. And so, do you want me to go through what I talk about?
Yeah, that would be awesome.
So, we think of our abdominal cavity here almost as like a closed container, okay? And at the top of your container, you have your diaphragm, and your diaphragm is your breathing muscle, okay? At the bottom of your container, you have your pelvic floor, which we kind of went through. Surrounding that, we have this deep core muscle that we call the transverse abdominis. And with all three of these kind of structures, we have a pressure that's in our abdomen. When you take a deep inhale, the diaphragm will drop into the abdominal cavity. With that drop, it's going to increase the pressure in here. And our body doesn't like that. Our body wants to maintain the same amount of pressures throughout. And so what should happen in a healthy system is as you inhale, the diaphragm will drop and the pelvic floor should also drop and relax. And so we start to utilize this breath. So you're sitting there on the toilet, hopefully using a squatty potty. You're going to take a nice deep inhale and imagine your pelvic floor dropping and relaxing and releasing. And then with your exhale, you can do your push and kind of move towards defecation. And you can practice this in all sorts of different positions. I just find that for most people, that is the easiest place for them to find that pelvic floor relaxation. And it's very hard because you can't see it happen. Like I can watch my bicep work, right? I'm like, oh yes, I'm using my bicep. You can't really see that area. So it has to be more of like a visualization and a like sensation that you are accomplishing this. And you can usually feel that a little bit better when you are defecating because it'll be easier for you to kind of push out the stool with that relaxation.
Yeah. And then how about postpartum? So someone just had a baby. So aside from coming and seeing a pelvic floor physical therapist, which would be an awesome idea for anybody who has a baby, no matter which way they come out, but other things that people should think about if they think about like wanting to return to exercising, how can they be mindful of their pelvic floor and help to strengthen it without causing any more damage?
Yeah. So, you know, there will be some weaknesses that kind of come up usually after having a baby, and there is a certain amount of that Kegel or pelvic floor contraction that will help with strengthening that muscle tissue, right? And you want to make sure that you don't have these other issues of pelvic floor tightness before you're just like, you know, making those muscles contract and work. But I feel like that can be a really good, important thing that you do. But it isn't just about turning this muscle on and turning it off. It's about using it functionally, right? And so it's about turning it on before you lift something. It's about turning it on before you have to go do a big strenuous activity, whatever that is, and like retraining your brain to talk to this area of your body. And I think that oftentimes people think of pelvic floor activation as just like on and off, on and off. But just like any other muscle, we have to work it in a lot of different ways. And so you also need to work on endurance holds where you contract and you hold for 10 seconds and relax. You have to work on like quick flick holds where you go on, off, on, off, on, off, right? So there's all different types of these Kegel activities or pelvic floor activities that need to be trained, as well as utilizing them in a more functional way, not just like sitting and doing your exercises, like turning them on and off. With the return to running, there is this like beautiful research article that was done talking about how to return to run postpartum. And it's a combination of time. I think a lot of women have their baby and they're like, okay, I'm getting back to running, right? And it's like, you need time to heal. Like I was talking about before with the knee, your knee needs time to heal after it has a surgery. Your pelvic floor needs time to heal after you give birth. And so you first of all need to just give your pelvic floor time. And then just making sure that all your other strength is back. Can you do single leg squats? Can you do single leg bridges? Can you, do the right kind of balancing? Can you bounce without leaking, right? And kind of very slowly working up these strength ideals to get back to that running place.
Very cool. Can you share that article with us?
Yes.
That would be awesome.
It's amazing.
Yeah, that would be really great. I'm trying to think what else. I guess another question I have just like pelvic floor wise is for older women who are approaching menopause, that's another time when pelvic floor issues can come up for people if they didn't have any issues before. So like what would be things for people to watch out for, and kind of what's going on there? Like, why do people sometimes have pelvic floor issues as they get older?
Yeah, so there again, of course I love research, and I don't have the exact, I should have the exact numbers, but if you have experienced urinary incontinence right after giving birth for a period of time, you are far, far, far more likely to experience it again as you age. And even if it resolves and you're better for many years, it's very likely that it could come back in kind of that more menopausal or older age period of time. And so just thinking back and just asking yourself, well, did I leak at that time? It's a really good thing that's like an indicator that this could be an issue for you. And, you know, as women go through menopause, they go through a lot of hormonal changes, and a lot of those hormonal changes change the actual environment of our vaginal canal and the kind of what's happening in that region. And with that, there can be some kind of tone issues and other things like that leakage can come around with, can happen with, is better terminology there. And I find that as long as women kind of keep up their strengthening, and not only in their pelvic floor, but in everything else, and they kind of do a really nice job of keeping everything healthy, they have better outcomes. And so that kind of, it's not just about your pelvic floor, it's about so much more than just that. It's about everything that supports it in those ages. One of the really common things for women is, you know, actually postpartum and or in the elderly populations, is that you get into a bad habit of waking up in the middle of the night and going to the bathroom. And that can be when you're younger, your baby's waking up and so you go pee because you're awake anyway. Or as you're older, you're awake anyway and you go, okay, I guess I might as well go pee. And you start this kind of habit, and then it becomes twice a night or 3 times a night or 4 times a night. And our bladder is sending these really inappropriate signals to our brains. And that is honestly such a huge issue, because not only are you training your bladder in a bad way, but also you're not sleeping. And sleep is so important for everything that we do. And so any sort of like urinary frequency, leakage, pain with sex, honestly, that can definitely come around the menopause time with de-estrogenation of the tissues. And there's all pelvic floor PT can help with all of that.
Okay, awesome. Cool. What else do you think that like people should know, like just to demystify the pelvic floor or pelvic floor physical therapist? Anything else that you wish that people knew that you could share right now?
Yeah. First of all, like especially with urinary incontinence, you're not alone. This is obviously not a thing that women want to talk about. We don't, or men, or anybody want to be like, oh yes, I pee my pants, right? That's not a comfortable thing for us to bring up and talk about. But it doesn't mean that it's not happening. And just because it's common and a lot of people are experiencing it doesn't mean it's normal. And you don't just have to accept that I leak a little and that's just the way it's going to be. There's a lot of things that you can do to kind of help with that leakage. And I think that if more people knew that, there would be like more people that would go into pelvic floor PT and seek out help and seek out these different options for themselves and live a happier life with a better quality of life. I think that, you know, obviously most people think of the pelvic floor as something that men or women only have. And like I said before, there are issues in our male population, there are issues in our childhood population. And so also kind of demystifying that fact that if you have issues and you're a man, that you can't seek help and that you can't talk about it, because there are people out there that treat men and know how to do it well and do a really good job with it. And that should definitely be something that they feel comfortable seeking out. And yeah, I think those are the main ones.
Awesome. Well, thank you so much for taking time to spend with us.
Yeah.
And yeah, if anybody has more questions about pelvic floor PT, you're welcome to leave them in comments and we can get back to you. But there's so many amazing pelvic floor PTs in Missoula, including Clare. So reach out to us if you need a referral, if you've got questions.
Yes.
So we really love pelvic floor PT over at Roots. All right, thank you all. Bye.